Okay.
Back again, now we're going to be doing the glenohumeral, labrum, and like slat pathologies, the special tests first, and the joint plays, I guess. First, we're going to be doing the glenohumeral joint plays. We're going to have the patient laying down supine. This you can have them on the table just for the fact that this table is not that big and it's kind of hard to get a grip. I'll have them come closer to the edge, not too far closer, but a little bit closer to the edge. So you're going to be hooking their arm into yours. You're going to be having gripping at the distal humerus. You're grabbing here. So for the glenohumeral joint plays, you're going to do anterior, you're going to do posterior, and you're going to do inferior. So for the anterior joint play, you're just going to grab the head of the humerus. You're just going to be doing that, looking for increased laxity. Posterior, same thing. You're going to be going posterior and inferior, going this way. Just looking for that increased laxity. It'd be positive if you have increased laxity. Next, we can do the relocation release test for the glenohumeral. Here, looking for this is glenohumeral apprehension, relocation release. Looking for that, looking for guarding or apprehension would be a positive sign for this. Just a glenohumeral pathology. So here, 90-90. First part for the apprehension part of this test, I'm going to be starting here, grip at the elbow, pushing until you feel patient apprehend. Then we're going to come back to neutral, apply a pressure here. You can actually grab here this time. Apply a pressure here, go here, and release and surprise them and see if they come back to apprehension or anything like that. Next, we can do the sulcus test. Have them standing for this or sitting. We're going to stand for this one. So this one, kind of same thing as the anterior or the sulcus sign traction test for the AC joint. This time, going to be the glenohumeral head. Going to be grabbing at the wrist. Same kind of thing we did, downward force. Have them relax. And we're going to see if there's, again, obvious deformity, a little bit of pain, but more of the sulcus will appear, would be a positive sign for this. Next, we can do some of the slat tests. Go back on your back. We'll actually do the anterior drawer test, so back on your back still though. Anterior drawer test is looking again for anterior instability. So for this, we're going to have 90-90 here. And we're going to do the anterior drawer. We'll be palpating, they're going to be here and here, 90-90, and they're just going to be applying the anterior pressure to the glenohumeral joint, looking for that increased laxity. Next we can do is the posterior apprehension. So have them off the table for this one as much as we can. There you go. Gonna have them here and here. Gonna be stabilizing posterior scapula, posterior glenohumeral joint. And it's applying that pressure, looking for apprehension or increased laxity on that one as well. Next we can do slap tests. So first one we're going to do is the clunk test. So back on the table, please. So for clunk, what we're going to do is we're going to come all the way to about full abduction. And what we're going to do is going to apply arm underneath the glenohumeral, apply an anterior force. And what we're going to do is we're going to externally rotate the humerus, fully externally rotate it. And what we're looking for here is a clunk. This would be positive for a slap lesion. Next one we do here, I think this point too, I guess, is the biceps load test. Here, we're going to be going to 120 degrees. We're going to be externally rotating again, looking for apprehension. And then what we're going to do is we're going to stabilize here and here. We're going to have the patient try to flex their elbow. So do like a bicep curl, so flex. So just flex hard you can. And what we're looking for there, probably shouldn't let that much motion, but what we're looking for there is more apprehension or increased pain. Going to be indicative of a slap lesion for that. Next, what we can do is O'Brien's test. We can have the patient standing. So O'Brien's test, and the patient come like this, We're gonna start the thumb down. So basically we're gonna be, hold right here, hold as you can. Basically what we're doing here is looking, basically treat this like a brake test. So we're gonna be, gonna apply pressure, so hold it here. Don't let me hold it. And what we're doing is tell them not to let us break them. So if they have pain with that, what we're gonna do is have them supinate the hand, the forearm. So go full like this, hold it just like that. Hold that. Same thing, we're gonna do the same test, don't let me break you. And if they had pain, that's worrisome. If they had pain with the first part, and then they had no pain with that, also be positive for a slap lesion. Next we can do the anterior slide test for a slap. So just kind of get the position right, you didn't even know about it. Hands on your hips, kind of elbow back a little bit. And what we're gonna do is have them relax, stabilize the shoulder. We're gonna apply an upward force, kind of an axial load into the shoulder, into the labrum, and up. Thing there would be just increase in laxity or pain again would be positive, another again from their slap lesion. So we did the apprehensions tests, relocation, release. We did our glenohumeral instability tests. They did anterior drawer, posterior apprehension. We can do the grind test, would be another one for a slap lesion. So I'm gonna go back on their back here. And so we're gonna do here for the compression. So you're gonna start them about 90-90. What you're gonna do is apply an axial load into the shoulder, and you're gonna be internally and externally rotating as you do that. What we're looking for there, again, big thing, pain, or can hear a clunk, stuff like that. Going to be positive for a slap lesion. We can also do the jerk test for posterior instability. So for jerk, we're going to be applying the pressure, going to be hearing here, applying that axial load as we go through into horizontal adduction. Same thing there, pain or just like apprehension could be another thing for the jerk test. Last one I can think of for anterior instability or glenohumeral instability is Fagan's test, or Fagan's sign, I guess. This one, we're gonna have the patient come to the edge of the table. What we're gonna do here is, I can have you come on right here, Jonathan. What we're gonna do is gonna come down to their level, wherever they're at. We're gonna have them put their arm on our shoulder, and we're gonna try to give a little bit more, elevation on this. We're gonna grasp at the head of the humerus, have them sit up straight, relax, and we're gonna apply kind of a downward force on the shoulder, looking for that instability again. A lot of laxity would be a positive sign for that. So we completed joint plays, we completed apprehension, relocation, release, clunk, compression, the grind test, Fagan's test, sulcus sign. Also completed anterior drawer, posterior apprehension, all the slap tests, O'Brien's, everything like that. Yeah, bicep to load and clunk, and yeah, that would be the end of our glenohumeral posterior, more glenohumeral instability test and labrum tests.